Good evening, everyone. Good evening. My name is Meg Wheeler. I'm a candidate for the Massachusetts State Senate in the Plymouth and Norfolk District, and I'm here tonight for our daily COVID-19 update. I go live every single night at 7:30 p.m. here on Instagram and over here on Facebook as well to give you an update on what's been happening at the state and the federal level. And I will continue to do this for as long as I am able to, as long as the situation is going on. So first and foremost, I hope everyone is staying safe and healthy. As always, I want to just give an incredible thanks to all of our frontline responders. So all of our medical professionals, our doctors, our nurses, our hospital staff, all of our police and fire and first responders, everyone working in the school system to ensure that our kids have the materials that they need during this difficult time. Everyone out there in the grocery stores, in the gas stations, the truckers who are bringing us the food, everyone who is essentially making sure that people have what they need during this difficult time. Thank you very much for everything you're doing. We know the incredible risk that you are taking and the sacrifice that you're making. And I am incredibly grateful for that. And that is just one of the many reasons why when I am in the state Senate, I will fight for you. So tonight I have a pretty short update for you, but then I have a couple of things I want to touch on. So just to give you an update of where we're at on numbers. Unfortunately, today we did see 8 deaths here in the Commonwealth. That brings our statewide total to 56 lives lost. We had an additional 797 cases today. Our total in Massachusetts is now 5,752. In terms of testing, we had an additional 3,727 tests done today. That brings our statewide total to 42,793. Across the United States, our cases are now just above 140,000 that have tested positive, with 2,405 deaths. From a state overview, Governor Baker today in his daily briefing said that they expect that the surge of cases here in Massachusetts will occur sometime between April 7th and April 17th. Now, this isn't a guarantee. This is just based on the data that they have and the prediction models that they've put together. But again, just to repeat, they're anticipating that the surge of cases here in Massachusetts will be between April 7th and 17th. This is why it's incredibly important that if you that you continue to abide by the stay-at-home advisory and continue to shelter in place as much as you're able to, even if it doesn't seem like it's doing anything or it doesn't seem like it's helping. It is, and it will continue to do so, and it's incredibly important. We have not gotten to the worst of this yet, so it's incredibly important that you continue to do that. Just a few other notes on that. So given the fact that the federal government over the weekend announced that they were extending their guideline to stay at home through the end of April, so through April 30th. So given that, Governor Baker has announced that he is reviewing the orders to close all non-essential businesses and the stay-at-home advisory, and he will likely have an announcement on that tomorrow. I would like to use this opportunity to renew my request that Governor Baker and frankly President Trump issue a stay-at-home order. I think we need a nationwide shelter in place. I know that that feels drastic. I know that people are concerned about the impact that will have on our economy, but I can tell you that I would not be taking this position if I did not truly believe that this was the only thing that was going to help us slow this curve. I have seen too many people continue to be out, continue to be socializing, not respecting the request for people to stay at home. And frankly, we're seeing a hodgepodge of rules in different states as states are dealing with the effects in their own states. And I do not think that we can have the impact that we need to have to flatten this curve until every state is on board and we have unanimous rules across the country to ensure that people are staying in their homes as much as possible, so that only essential folks are out. I do want to just give a couple more state updates. From an employment perspective, this is something that I know a lot of you are very anxious about. A lot of you have reached out to us about. Please continue to do that. We are very happy to be a resource for you. We are staying up to date on all of the options. But I do just want to note that in terms of the state unemployment, so there's obviously the regular state unemployment program. That is, of course, available. If you qualified for that before, you certainly still qualify for that now. The $2 trillion federal stimulus bill that passed on Friday and was signed by the president on Friday, That includes additional unemployment benefits for people who would already have qualified for unemployment. It also expands the unemployment program to folks who did not previously qualify. So if you are looking for those additional federal benefits, or you were one of those people who did not previously qualify for unemployment but do now under the expanded federal stimulus bill, this would be if you're a 1099 or contract worker, for example. If you are one of those folks, the state has said that they are still waiting on guidance from the federal government on exactly how to implement those benefits at the state level. So please do not file for uninsurance right now. You may have already noticed, if you tried, that you hit a few glitches. They are waiting for guidance from the federal government. Once they have that, they will implement their processes for distributing those funds to those people. Again, this is just for people who are looking for benefits as a result of the federal stimulus package. So if you lost your job and normally would qualify for unemployment, that's perfectly fine. Please continue to go ahead and apply now. But if you are one of these people who will either get additional benefits or will get benefits at all under the federal plan, we do need you to wait to apply. The application is not ready. The system is just not ready yet to distribute those benefits. And so the state is asking you to delay your application until they have more guidance, and that they will announce when they are ready to take applications. And of course, we will announce that here on our update as soon as we know that, as well as on our Facebook page. Let's see, was there anything else I wanted to say on that? I think that was everything I wanted to say on that. One thing I wanted to touch on while I'm here live, and if you have any questions for those watching live, please do drop them in the comments. Let me know. I'm happy to answer questions. But I did want to touch on another big concern that we've been hearing a lot about, which is the lack of PPEs, or personal protective equipment. So if you've been watching the news or maybe seen this on Facebook, you will know that this is a huge issue, that hospitals and medical facilities are running incredibly low on PPEs. This is everything from masks to gowns to gloves. The state has set up on their website, on mass.gov, they have set up the ability for people to donate or sell equipment that they have. So if you are a nail salon or a restaurant or a construction company, and you have some of these supplies and you're able to donate them or even sell them to the state, please go to their website. If you go to mass.gov, you'll be able to access, it's a form, very simple form to fill out. They're asking everyone who has supplies to please do that. It's incredibly important right now. The state has requested, Massachusetts has requested PPEs from the federal government. As of right now, we have only received 17% of what we've requested. This is going to increasingly become an issue. It's already an issue, but as the governor has said that they expect the surge to be between April 7th and April 17th, this is going to become an even bigger issue. So please do what you can. If you have supplies that you can donate or sell, if you've got a company that can retool its machines to create supplies, that is incredibly important right now, and we are asking for that. Similarly, if you are able to give blood, this is another request by the governor today. I know a lot of people have reached out and said they want to. They've gone to the Red Cross's site and they aren't able to make an appointment. Understandably, there are a lot of delays right now. They are working under a revised system where people can't just walk in and give blood. You make an appointment and you go in at a certain time so they can make sure that you're doing this and take all the appropriate precautions. But if you are able to give blood, I highly would encourage you to go to redcross.org, find an appointment if you can at some point in the future. Even if it's 2 or 3 weeks from now, that's okay. They're going to need the blood. So please sign up if you're able to do that as well. The last thing I wanted to address on tonight's live is less of sort of an update and more of just something I've observed. So, we're obviously paying a lot of attention to what's going on both in the news and across social media, as we're wanting to make sure that we can bring updates to all of you. One of the things that I have noticed in a lot of different areas online is an incredible amount of judgment of people right now. Sometimes this is judgment towards parents who are struggling to figure out how to balance their kids being home and their work. Sometimes it's judgment for people who suffer from anxiety or depression or other mental health issues and are struggling to manage through this time of incredible isolation. Sometimes it's judgment for people who are still running their businesses and are still selling. And how could they? How could they be asking people to buy during this time? We've even seen it on our own campaign where we've had people accuse us of being cruel or, or evil for asking people to donate to our campaign. And I just want to say this because I think it needs to be said. Everyone is dealing with this situation in their own way. Everyone is having their own struggles. And this is an unprecedented situation that we're all going through. And I think we can probably all agree that none of us are going to handle it perfectly. We're all trying to figure out what the right thing is, what the best way to get through this is, and how we can manage all of the different responsibilities in our lives, whether that's work or family or health or financial. And I would just ask all of us to please extend a little bit of grace and of patience with each other, and know that every single one of us is doing our best and is simply trying to get through this in the healthiest way possible. I also want to say that life is still going on. There are, as a small business owner, I still have to run my business right now. I don't have the luxury of shutting down my business for a few months. I just don't. I don't have the financial means to do that. Certainly, it would be great if I did, but to be honest with you, even if I did, I'm not sure I would, because I serve people in my business. I help women and entrepreneurs in my business, and they still need help right now. And I'm not forcing anyone to buy from me right now. I'm not forcing anyone to pay me money or work with me right now. I'm showing up and I'm serving my people because that's what they need right now. And I would just encourage you to think about that side of it, that, yes, we are all struggling. We are all stressed about this. None of us know what's going to happen. There's a lot of uncertainty. But it is so important, in my opinion, that we keep showing up every day as much as we can, as long as it's healthy for us to do so, that we keep showing up virtually, of course. We keep showing up virtually every single day, because that is what our society needs to keep going forward. If we all shut down, if we all give up, then we're not going to get through this. So to all my small business owner friends out there, it is not wrong if you are selling right now, as long as you are doing it within the confines of the stay-at-home guidelines. Okay, it is not wrong for you to do that. To all of my friends who are campaigning right now, who are trying to get signatures to get on the ballot, and you're receiving, hate comments from people, I am so incredibly sorry for that. Democracy does not stop because of something like this. In fact, it's all the more important right now that we ensure we are keeping our leaders accountable and we are keeping our elections fair and ongoing. And so, and to all my parents out there, let me just say, I'm in it with you. I am in it with you. Today was our first day of our schedule, our homeschool schedule. And it was rough. It was really rough. I'm not going to lie. We did our best, but Jack's almost 3, which means that he doesn't actually want to do anything we want him to do. And it's tough. It's tough to watch a kid and run a business and run a campaign and stay healthy and be there for your family and worry about what's going to happen. And so I get it. I get where you're at, and I'm here for you. So I just want to say that I would encourage all of us to remember that we're all going through a really tough time right now, and that we're all handling it in the way that we can. We're all handling it in our own ways, and we're doing our best. And I think if we have a little more patience with each other, I think that'll go a long way. So I want to just wrap this up by reminding you of a few action items. I said this at the beginning, but please stay at home if you can. It's so incredibly important. And to donate blood if you can. Again, by going to redcross.org, you can make an appointment. If you cannot find an appointment, just please keep trying. They will continuously need donations of blood as this is ongoing. Lastly, I just want to wrap this up by saying again how incredibly grateful myself and my entire team and my family are for everyone who is out there on the front lines fighting for us. All of the medical professionals, the doctors, the nurses, the therapists, the hospital staff, all of our first responders, police department, the fire department, our town managers, their incredible staff, everyone in the town who is working to keep our town safe, everyone in the schools who is working to get us the information we need and the support that we need so that we can care for our children during this time. Everyone who is out there in those essential businesses, our grocery stores, our gas stations, our truckers, our pharmacies. Excuse me. We are so incredibly grateful that you are out there and working for us. And the least we can do is to stay home so that we can keep you safe and healthy. So if you have any questions at all or you need anything at all from us, please reach out. Our email is hello@megwheeler.com. Our campaign line is 781-724-3461. And we have set up a COVID-19 resource page. We are continuously updating this. If you go to megwheeler.com/COVID, you can access all of those resources. Please DM us on Facebook, on Instagram, or on Twitter if you need anything from us at all. We are here for you. We will continue to be here for you every single night at 7:30 p.m. And in the meantime, stay safe, stay healthy, and we will get through this. Have a good night.